free. Battle in the storm with courage and grace. Shayna's got the wisdom to help you embrace. No more relying on pills they don't know. She's got the strength to help you grow. Feel the power rising inside. Shayna's guidance right by your side. Life's getting brighter step by step. With Shayna's touch, you're gonna prep. Feel the power rising inside. Shayna's guidance right by your side. Life's getting brighter step by step. With Shayna's touch, you're gonna prep. Medicine shelves are emptying out. Finding real strength, that's what it's about. No more prescriptions tying you down. With Shayna's help, you'll wear the crown. Ladies, hear the call, it's time to rise. Shayna lifts the veil, opening eyes. No more shadows breaking your day. With her wisdom, fight pain away. Broken paths don't mean you're lost. Shayna shows to bear through the cost. Healing hearts one smile at a time. With Shayna, you'll shine forever and feel the power rising inside. Shayna's guidance right by your side. Life's getting brighter step by step. With Shayna's touch, you're gonna prep.
Finding the strength deep inside. Shayna Melissa takes us on this ride from suffering to a life so free. Her healing touch, she'll set you free with the heart.
Hey, nurses on strike. What again? What does that mean for you and your health? Which hospital should you go to? Steer clear of. Why and for how long? I'm a fellow New York nurse and NISDA member myself, Shayna Melissa Stockman, a 33 plus year nurse practitioner and registered nurse who empowers mostly ladies to reclaim their life, regain your strength, energy, focus, and happiness. Why? Because you are deserving, you matter. I'm now known as the autoimmune expert. Now, you guys ever have a problem and you just use a quick fix, right? And maybe you ever seen a roof leak and you put a quick bucket under it and you know that's good for now, but it's still stressing you out. It's not solving anything and the problem's getting worse. But what if with your problems, you had the tools that you needed and the expert to truly fix the problems for a long time to make you happier and bring you more joy? That's what we want to help you do. It is time for you to reclaim your life. Right now, you can reserve your no cost or VIP seat. So mark your calendar for Wednesday, February 11 at 7 p.m. EST. You can simply scan that QR code or just go to that link right there, worldwellnessexpert.com/reclaim. There is an absolutely no cost version. It is live. It is not 5 days, 3 days, 3 hours. It's 1 power hour, absolutely no cost to you. So please mark your calendars and reserve your seat now while there's still no cost and VIP seats for Wednesday, February 7th at 7 p.m. The VIPs are going to get an amazing experience. If you'd like to level up to the VIP, simply use coupon code SAVE50 before it expires. That will bring the price down to $47. down to $47, or you can simply take the no cost option. Either way is there. If you don't see a VIP option, when you do the no cost, it might then divert you if there's VIP seats left for that option. So again, wellnessexpert.com/reclaim. Enter coupon code C50. Now moving right along, I want to share with you all about the nursing and the strike and the situation, and maybe enlighten my fellow nurses on what's going on, and also enlighten non-nurses on what the nurses go through. If you look at this picture here, I started my nursing career well over probably 35 years ago now. Let me see. Yeah, over 35 years ago I started my nursing career. That is me. Actually, I think that picture is 1992, one of the nursing graduations. And I've been a registered nurse now for well over 33 years, a licensed registered nurse for well over 33 years, and in the field before that. And I grew up with naturopathy, using plants to help us get better and feel better before everyone was popping all these pills and all these scripts. And you know what? Nursing was so much different back then. My old school nurses, we were doing vents and dialysis and home care and hospice, and I was teaching, and it wasn't time, and numbers game at all. And then, you know what? Yeah, look at this picture here. Over the years, our career changed so much. We went into nursing, the nurses, to truly help people get and feel better. But over the years, we were given more and more and more and more tasks with less and less staff. Originally, when I started over 30 years ago, we were paper charts, right? Now we had to learn the computer systems, the EMRs, the ICD-9 codes, memorize those, then memorize the ICD-10 codes. We were doing coding as a nurse. You know what? We were made to see more patients in less time with less staff. And then it got to the point where I was grabbing my first bite to eat after like 10 hours in a shift. I had no time to grab my first sip. And that, you know what? If our treasured loved ones need us, we weren't allowed to use the phone. We weren't allowed to eat during our shift or drink during our shift. I was told not to use the restroom, okay, yet, even though I was ahead of where I should have been for my nursing at that time. And it was all about the numbers. Do more, see more. How many did you see today? And if you look at this photo right here that we're watching, you see I was doing 16-hour nursing shifts back to back to back overnight. So a 16-hour shift, you come in a half hour early, you leave a half hour late. That's 17 hours. An hour commute each way. That's 19 hours out of your 21 hours. Then say you take in an hour to eat, meal prep, shower. Now you're up to what? 20 hours or so. An hour for errands, that's 21. That leaves you 3 hours to sleep to be back to work and do it again. And I was doing that Friday night, Saturday, and Sunday night. So I got more hours, us nurses got more hours sometimes in the weekend when others were off than you guys did in an entire 7-day week. So please give your nurses some TLC that they deserve. We were asked to, when I did vents and home care, we weren't allowed to, it wasn't Monday through Friday, 9 to 5. You guys don't realize the patients are sick 24/7, okay? We were not given holidays, nights, weekends. We were simply asked, out of all the holidays this coming year, which one would you like off? So how would you guys feel if you're not a nurse? Would you like off Christmas or your birthday or Thanksgiving or New Year's? Pick one holiday. And that's my story, and I'm sticking to it. Now here is going to show you, when I was working for an insurance carrier, we had poor health insurance, so I can relate to what my nurses are going through. If you guys are a nurse, drop down nurse. If you're watching live or on the replay, drop down #live or #replay. You know what? When I worked for an insurance carrier, they fired all the pregnant nurses so they didn't have to give maternity. They fired all the union nurses so we couldn't help each other and power in numbers. You know what? We were asking off months in advance, sometimes a year in advance for a special day, being told no. I remember being asking off 6 months in advance for my niece's wedding when I never used a sick day or holiday, and told no because we had no coverage. So what good is if we have all these great sick time, holidays, and vacations if they never let us cash one in? You know what? The nurses are worried about retirement, pension, stability, safe patient staff ratio. You know what? And I realized that my job was killing me. I was in heart failure during the pandemic with skeleton crew, triple the amount of patients. And at the end of the day, the admin did rounds and said, not how are you? But how many did you see today? I can only see the number that walk in the door. So I can relate to all you healthcare pros out there, the caregivers, the nurses, the healthcare pros that are not nurses, that might be CNAs, PAs, the physicians. My heart goes out to you. So check out this slide here. About 15,000 of my fellow New York nurses are on strike right now in New York City. This is the largest New York City nursing strike ever. Now, this is important for you to know. If you have a true emergency, of course you go to the nearest ER. But if not a true emergency where you've had a cough for 2 weeks, please try to stay away from these facilities right now because they are on strike. They do not have the staff to hire to take care of the patients they have, that a lot of their units are closed and a lot of their patients have been transported or redirected elsewhere. So if it's not a true emergency, try to stay away from, in New York, Mount Sinai, New York Presbyterian, and Montefiore, as well as their satellite locations, which is, I think, about 7 other campus locations. These nurses, my fellow New York nurses, they're not fighting for huge raises. They are fighting for safer staff patient ratios. That means more staff to the amount of patients, not 30 patients to one nurse, okay? So they are fighting for safer guidelines, for more staff so that they don't have as many patients each, so that they can safely take care of the patients and not ignore them. Because when there's 30 buzzers going off with one nurse, she can't possibly attend to all 30 patients at once. They are fighting to secure their own health benefits from being cut when they work at a healthcare facility and the hospital. They are fighting to secure their pensions and their retirements and against these big pharma guidelines. Now, a leopard never changes its spots. These same nurses were striking in 2023, a lot of the same nurses in New York. These nurses survived the lethal pandemic with no PPE. I think they deserve safe patient staff ratios. Now, the leopards never change its spot, so I don't anticipate these big, huge facilities are going to all of a sudden change anything. Now, next due to strike are Hawaii, Florida, and possibly California. Now, I want you to know that I was offered more than 400 times per hour that these New York nurses are getting to take their place, so to speak, while they're out on strike. And my fellow nurses, I could not do it. I could not go against you. I am in full support of you, even though I could have made 400 times your hourly salary. I want you to know this is not to rub it in your face. This is to show you how much I am on my fellow nurses' side. And please, if you're a nurse out there listening, do not, I would highly recommend not working for one of these agencies to go against what the nurses are doing, because they're not fighting for themselves. They are fighting for the patient's safety. These nurses, there's so much more violence right now by combative patients that might be drug seeking, pain seeking, coming off of heavy psychedelics or medications, that they are fighting for more staff for their own security and the security of their patients. Recently in New York, there's been a lot more stabbings and gun shootings in the ERs. So they are fighting for the nurses. So please, guys, give some TLC to your nurses. If you see them out on strike, buy them I don't know, a cup of coffee or whatever, a pizza pie, a donut or something. My heart goes out to you. Now, well, when we started nursing, when I started over 30 years ago, we used food as medicine. And thank God JFK Jr. is starting to bring that back right now. You see this like banana here. Like I remember when my grandma raised me in the 70s, she would eat a banana every day for the potassium. So she did not need a blood pressure and a cholesterol pill. We would use the power of manuka and honey for our own immunity. We would use garlic for its anti-inflammatories and to keep down your blood pressure and your sugar. And we would use baking soda to instantaneously reduce the stomach acids so that you would need, one of those prescriptions for your symptoms. And these remedies really attack the true root cause. But over the years, we're going to more and more and more and more meds. As you see here, you can Google Rockefeller and how medicine started. And I want you to do that. I don't have time for that right now. But the reason I'm so passionate about this is because my grandpa was a licensed pharmacist and he died of a lethal prescription drug interaction. So we should not resort to them first. We're pushing it way, way, way too much, and we should not be. It's a leading cause of death in this country. And you know what? Now that when I started nursing, most of our patients were not on meds, and maybe they were on one or two, but then they needed three meds for their blood pressure, and three for their cholesterol, and three for their diabetes. As you look at this next slide right here, this is going to show you through my nursing career. When I started my nursing career, we were told that cholesterol of 300, 240, 200 was okay. Blood pressures were acceptable at a higher level. Sugars were acceptable. But you know what? Big Pharma wants to do more and more and more studies to try to prove the efficacy of more people being on it at lower numbers, because then they could require it for more patients. So that's exactly what they did, is gear studies to prove, hey, you know what? Your cholesterol should be 300. It should be 200. And years later, no, it should be 150. And years later. So you know what? Over the years, more patients are on more meds now than ever, but yet we are sicker more than ever, and we're having more deaths now than ever, and our life expectancy is going down, not up. With more meds, it should be increasing. Something we're doing wrong. If you look at here at this graph, it is showing the deaths from prescriptions, and legal and illegally used drugs supersedes the deaths from all motor vehicle accidents and gun shootings together. Okay, so we're giving more and more and more meds, but we're having more and more and more deaths now than ever, and our life expectancy is decreasing. So we need to do more about it, and that's why I'm passionate about what I do. And this picture here, the lower right, you see that was a talk I gave this past Tuesday. The raw, honest truth about medicines and these protections and other things. If you missed it, it's on the YouTube handle at Shayna Melissa. You can catch the replay there. Now, this big pharma greed. Check this out. Now, I gotta watch what I say here, but this will give you an idea. Big pharma, right? Bayer sells aspirin. Aspirin is a treatment, right? Bayer bought Roundup. That's linked to cancer. Bayer sells the cancer treatments. Now, can we put that slide right up? Maybe they can see the words. So again, I'm going to say this. Bayer sells treatments, right, to get you better, like aspirin, Bayer aspirin. Bayer bought the company Roundup that is linked to cancers. Why? Because Bayer also sells cancer treatments. So why not buy the company Roundup that's spraying it everywhere, that's linked to cancer rises, right? So I want you guys to know the nursing that we're in now with the big pharma greed is not what we signed up for. We didn't sign up for falsifying studies to prove more people need more pills and more meds. We did not sign up for that. Now, this next slide might be a little controversial. I am not opposed to vitamin K for babies, but look at all these other things we're putting in that newborn: benzyl alcohol and polyethylene. So I'm not opposed to the vitamin K. I'm opposed to the other things in it. Nurses went into nursing to help people, protect them from things that were causing harm, like too many medications, like adverse drug reactions, dependencies, overdoses, heavy metals, carcinogens. But yet then they were expected to give these and to give a newborn hepatitis B, even if both their parents were negative for it and both parents had the protection. What are we doing? So nurses are getting burnt out now more than ever. Why are we doing this to babies? Because if you get a baby sick, you have a lifelong customer, big pharma. Okay. Yes. Look at this chart here. When I started nursing, this is how many we were giving to the babies. Now, I don't have enough fingers and toes for how many we're giving to the babies. This is insane. Wonder why our nurses are burning out. It's got to stop. Way too much. Thank you, JFK Jr., for getting rid of a lot of the mandates that are not really required. All right, so the good news. Now we're off to the good news. I love doing good news. So Junior recently said, "Hey, these 11 are required. All the rest are not required anymore. It's up to the parents if they want to give them or not. That will not affect if the insurance covers it or not. Will not change anything. But some of the states are going to push to get all of those on every child, even ones that we don't believe are necessary anymore. I'm not saying don't get them. I'm saying weigh the risk versus the benefit. And if your baby is extremely low risk, maybe your baby does not need that one, but might need a different one. So discuss it with your licensed healthcare pro. Now, if you look at this next photo, this is my talk last Tuesday. This auditorium held over 200 people. Well, holds 200. And I gave this talk in person Tuesday. My in-person talks are things I will not say here and cannot say here. But I want you to know, I went into that audience and I said, hey, these 200 seats, how many of you ever heard of anyone taking any medication for a chronic illness and was cured of it from that medication? Raise your hand. Not one hand went up out of 200 seats. So listen to this question. Have you ever heard of anyone ever getting cured from a chronic condition with a medication? Raise your hand. Not one hand went up. So, here's some of the book signings I did after. So I thank you for all those that attended in person, those of you that got copies of my book. We had cancer warriors there. We had fellow nurse practitioners there. We had doctors, pediatricians, and so much more. Thank you guys for all those that turned up, that got copies of my book. And then other good news, I saw my book in the library. I think this was like yesterday. Ooh, I love seeing my book in the public libraries and in the private libraries. If you want a copy, reach out to me or go to the website. Other good news. Oh, okay. So my Facebook personal page now has 46,000 views within the past month this year. Which, woo, 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 woo. If you're not already following it, please do. Please also follow the business page. The business page is Shayna Melissa. Click the follow button. That's how you know you're on the business page, because a lot of the things will be on the business page. Yes, you see here, this a lot of these words I cannot say. So please be sure to follow me everywhere in case I'm in that jail, that Facebook jail, that you're following me, you're getting my newsletter. Just go to worldwellnessexpert.com. Please make sure, click that button. There's a button there that goes to the newsletter. You want to follow me on all the socials and subscribe to the YouTube. This way, if you don't see me on one, maybe I magically disappear, you find me on the others. Now, here's the website, worldwellnessexpert.com. From there, I made it very easy. When you're on the website, worldwellnessexpert.com, a lot of things on that website are clickable. It says, hey, you know what? You want to watch the Shayna Show? Then you click down there. If you want to do the workshop, you click over it. So a lot of these words on the new website, it's totally revamped, are clickable. So move your mouse around and see what you can click on. You can click on Watch the Shayna Show. You can click on Join our upcoming live Reclaim Your Life super workshop from the comfort of your home. And be sure in the upper, there'll be a Contact Us tab and a symbol that looks like a link tree. When you click there, you can follow me on all the socials, subscribe to the YouTube, but most importantly, if you're not getting my newsletters and you haven't signed up while you're on the website, worldwellnessexpert.com, click the Contact Us tab or the newsletter tab. You might see a pop-up, get the newsletter. Make sure you drop your email because I have control over that. People might put me in Facebook jail, but they can't control my email list. So make sure you're following, subscribe to not only the channel, but getting our newsletter. Now, I also want you to know that you are worthy. You are deserving. You might have heard me say this before. It is your time. If not you, who? If when? I want you to know, as a fellow nurse, I was always telling the caregivers of my patients, listen, you got to take care of yourself because you're running around, you're not eating, you're not sleeping. If you get sick, you can't take care of that person, especially if you're in the sandwich generation where you're taking care of the kids and the parents, and you're in that sandwich generation. You must take care of yourself. You are worthy. You are deserving. It is not selfish. It is selfless. So when that oxygen mask comes down on the plane, if you don't put it on yourself first, you pass out or die, and you can't help the children and the parents, right? No, when that mask comes down, you must put it on yourself first. So then you can survive and help the children and the aging parents. So please, guys, don't be, please know that you're worthy, know that you're deserving. Put your oxygen mask on first. I had to learn this the hard way. I was in heart failure during the pandemic, working in ER on a crew, taking care of the world and not myself. And I'm like, what am I doing? I am worthy. I am deserving. I'm like, if me as the healthcare pro, as the provider, if I don't take care of myself, excuse me, who the hell is going to take care of me? Because I am the provider of everybody. So, and that was my wake up call. I was getting worse and worse and worse. And I knew if I did not prioritize my health and my one life over my job, I would be dead. So I want you to know out there, you must prioritize you and your health over your job, over your career. Because you know what? If you don't have that, they say health is wealth. If you don't have that, then you are dead. What is your business worth? What is your job worth if you can't do it? So if you look at this next picture here, I want to show you, like I just caught this on Facebook this week. I think it was Facebook. It was one of the social medias. Now, a lot of people are getting denied. This is why a lot of my clients are going outside of network. All of my clients have insurance and come to me because of this. Within you get what you pay for. Okay. You ever hear that expression? In their insurances are denied, right? So they're not even getting the tests that they need, the treatments they need, the providers that they need. And I saw this post online. Now, I hid who posted it, but they had said this is a medical liaison company. They said, I have not fact checked this, that Humana, Cigna, United Healthcare, and Optum are using AI to deny your coverage, your provider, your tests, and your treatments because they said a nurse cannot actually do the denial. So these companies are auto generating using AI to deny you seeing the healthcare provider, getting the tests you need, the treatments you need, and the meds you need. Other ways we can combat this is using going out of network. It's going to be a lot cheaper on you, and I'll tell you why. You might have an option to use an HSA, health savings account, or a flexible spend down, or a deductible that you must fill anyway. A lot of times we have to retrain our brain. It is cheaper a lot of times to go out of network. Let me give you an example. Your copay is $50 for your medicine, but if you were a cash payer and bought the generic, it might be $7. So please, guys, don't just think, is it covered by insurance? Is it covered by insurance? They've been brainwashing you to think that. A lot of times your meds might be cheaper as a cash payer. I'll give you another example. I just had a lab test that was $152 was billed the insurance and denied. But if that patient went as a cash payer to the lab, it was a $11 test. So please, guys, don't just think, is it insurance? Is it covered? You have flexible spend down, you use it, have FSA, you have a deductible, you have out of network benefits. Now, if you look at, I'll give you an example. A lot of times the doctors, not purposely, but how they're trained and how they're what they learn, they keep you sick on the meds, right? You need these many meds. I had a client recently. This is just one example from a presentation I did on Tuesday, live in person. One person that came to me out of network, I was able to safely, after I controlled her symptoms, taper her off 4 of her medicines. I'm not saying ever stop any of your meds and ever do it on your own. Taper down one at a time with your licensed healthcare pro. But after I safely tapered off 4 prescription pills a day, times 365 days a year, that's over 1,000 pills less a year of dependencies, interactions, overdoses. But I had another client I was able to safely, after working with her for a couple months, taper her off 8.5 of the meds. So I did a quick calculation here. So if you guys are thinking, oh, is it covered by my insurance? What you do, check this out. 12 months a year. So all of your prescriptions, you got to times by 12, right? Now, 12 months a year, say 10 prescriptions, let's just round it up. 10 prescriptions. She saved 9 prescriptions after she worked with me. Let's round it to 10. 12 months a year times 10 prescriptions per month. That was 120 prescriptions a year she was on, 120 copays just for the medicines. And say your average copay is $30. So 120 copays. We took 12 months a year times 10 prescriptions a month was 120 copays for prescriptions. Times that on average by about $30 a copay. And we got 3,600 a year less she's having to spend on those medicines. 3,600 less a year or whatever on those meds. And then if you times that by the next 10 years, because now she's saving over 36,000 in 10 years on just the medicines, okay? So please guys don't say, "Oh, are you covered by my insurance?" Look how much I'm saving her. I'm saving her $3,600 per year on the meds, plus 36,000 in 10 years, plus all the copays to go to the doctor, the double copays for the specialist, the meds that aren't covered, getting sick. We know, especially business owners, if you're sick one day, you could lose thousands of dollars. So please don't ask yourself, how much does it cost to get healthy? Ask yourself, can you afford to stay sick? Okay, so my heart goes out to you. Like I said, I was in heart failure and I had to learn I'm taking care of the world. So I want my fellow nurses and healthcare pros to know, if you are taking care of the world and no one's taking care of your health, it's time to wake up, because if you don't do it, nobody is. Nobody's going to care more about you and your health than yourself. You must reprioritize your health and your life over your job and over your business. Now, the reason I show you these eyeballs is I was on a conference about a year ago, 100,000 women on there, 200,000 eyeballs. I was asked out of the entire audience, if you could tell yourself one thing, or talk to yourself, what would it say? And I said, excuse me, I said, why the hell do you treat me so bad? Why the hell do you treat the world better than me? I too am worthy. I too am deserving. You know what? If I didn't have to be my best friend, I wouldn't be. Because you know what? I treated the world and everybody else better than me. But who else is going to be around me for the rest of my life? Me. So why not treat myself as good, if not better, than I treat my bestie? Because you know what? I'll be around me longer than probably that bestie I have now. So I want you guys to know that. Please, you are worthy, you are deserving. Now, when you look at this bucket again, you're going to see that these a lot of times these prescriptions are quick fixes. They're like that bucket, right? It's raining, you need a quick fix, boom, you put the bucket underneath, right? We know it doesn't fix the problem. We know the problem's getting bigger. We know you're going to stress less. It's just a quick fix for now. But when they give you the meds, they're looking at that as a quick fix for now. But what if you had the tools and the expert? Say that roof was leaking, you had the tools and the expert to guide you and show you how to fix the roof, or better yet, fix it for you. Would that not save you tons of time, tons of energy, tons of stressing and ulcers? So I want to be the expert for you. I am the autoimmune expert. And for those of you that don't know, I had all of these symptoms and I was in heart failure. I had weight gain, higher sugars, higher blood pressure, higher cholesterol. I was gaining fat weight, even though I was eating right, exercising. My hair was falling out. I was getting weird rashes. I couldn't breathe. I was exhausted. I was getting palpitations. I had heart failure and diagnosed with MS. And it wasn't a healthcare provider that helped me. It was me. After all of my years of research, I helped holistically heal myself. And then some of my doctors became my clients. And I want to be the expert for you, because most people are going to Google for the next 30 years and never figure it out. Why not learn from someone who's been there, done that? Only take direction from someone who has been where you want to go. And you guys can be doing research for the next 30 years and not figure out. I have 5 college degrees, 33 years as a licensed healthcare pro, 4 nurse practitioner nursing licenses, my own personal autoimmune experience, and thousands of patients. So I don't have to say, try this, try that. You're not a guinea pig. I do not give you orders like a doctor. I give you all the information so that you can make an informed decision. And I want to be the expert for you and give you the tools you need to fix the problem, so that you don't need the quick fixes that lead to more quick fixes and more problems. So I want to help do that for you, and I know I can, but only if you take action. So that's why I created this workshop for you, because everybody reaches out to me. What did you do? I don't have enough hours in the day to explain it to each person individually. That's exactly why I created this live power hour. It's not 5 days, 3 days, or 3 hours. It's 1 hour. And the no cost is a half hour. And I also created it at no cost. So the reason I did this is one is a power hour. There's 24 hours in a day. You are worthy and deserving of at least this one out of hundreds in the month. It's not a recording, it is live. It is that you can do from the comfort of your couch. So if you're not in New York, you don't have to miss out. But I can't spend this amount of time with each person separately telling you what I did. And this way I can offer to you at no cost. So what you need to do is scan that QR code with your phone. But if you're watching from your phone, just go to worldwellnessexpert.com/reclaim and claim your no cost, which is free, or your VIP experience. I created both a no cost version and a level up to the VIP version. So this way, price point cannot hold you back at all. And it is live. If you're like, I can't make this date and time, there's no excuse because the VIPs get the replay. Only the VIPs get the replay. So how this is going to work? It's going to be live Wednesday, February 11th at 7 p.m. EST. The freebies are going to get a half hour, 7 to 7:30. Then the VIPs are going to get a Zoom power hour one-on-one with me. Well, power hour with me live for a much deeper dive, fun, interactive, taking action. The VIPs are also going to gain the replay access. So a lot of people do the VIP if they can't make the date or time. They're also going to get the digital and printable blueprints. Now, this is the no cost and the VIP. The VIP is $97, but when you use the coupon code before it expires, SAVE50, all lowercase, it drops it to $47. I am limiting the number of seats. So, and I am having the coupon code expire soon. So please, the call of action is now. Do the no cost or the VIP. It does not matter to me which one you do. I just want to move your needle forward and help you. But I can tell you the people that gain the most benefit are the VIPs because they're also getting a complimentary one-on-one consultation private with me at another time for only $47. For those of you that know me, I charge $600 for a consult. So if you don't do this at $47, you're probably not gonna, and you might as well just tune out now. If you have no symptoms, great energy, take no medications, don't care about living longer or living a better quality of life, then you know what? Fine. You don't need this. Just click that share button because I'm sure someone else you know is suffering with exhaustion, brain fog, weird rashes, all these meds, and they're not feeling any better. They're still getting worse, and they can really benefit from this. Is right now, if you haven't already joined, go to worldwellnessexpert.com/reclaim, claim your no cost or VIP seat. If you don't see the VIP seat, register for the no cost, then it might offer you the option for the VIP. Then mark your calendar. It's more fun when you do it with others. Feel free to have others register with you. They can be your accountability partners. But if you don't do it, then I can't help you. That's all I gotta say. So you are worthy, you are deserving to put your own damn oxygen mask on first. You can't truly give the best to those you're caring for unless you take care of yourself. You can't afford to get sick, and that's going to cost you a lot more hours of downtime when you can't take care of the children, the significant other, and the parent. So you're worthy, you are deserving. That's all I gotta say. Just go to wellnessexpert.com/reclaim. Register now before the seats are gone and the coupon code works. Enter coupon code SAVE50, all lowercase, and I hope to see you there.